In this video, we will learn about branch retinal artery occlusion. So this condition occurs when a small branch of the central retinal artery is blocked, leading to ischemia in the specific area of the retina supplied by that particular branch. So this results vision loss, which is often more localized compared to that of central retinal artery occlusion. And this branched retinal artery occlusion typically affects individuals over 60 years of age and shares similar causes with the central retinal artery occlusion. As we know that the thromboembolism often originating from the carotid artery atherosclerosis is the most common cause. And other contributing factors include cardiogenic emboli from atrial fibrillation and vasculitic condition like giant cell arteritis. And now when we talk about the clinical features, the hallmark symptom is a sudden painless visual field loss which may present as scotomas or blind spots in the affected eye. So unlike that of central retinal artery occlusion, the central vision is often preferred in this particular condition. And the severity of vision loss mainly depends upon the location of the occlusion within the retinal branch. And now when we talk about the diagnosis, a thorough eye examination including fundoscopic evaluation is essential for diagnosing this condition. And the key features include a segmental retinal ischemia with a gray-white discoloration in the affected retinal quadrant, narrowing of the retinal vessels in the affected area, and the retinal emboli, which is often visible in up to 65% of the cases, suggesting a thromboembolic cause. So this is how the diagnosis can be made for this condition. And finally, we'll move on to the treatment part or the management part. As with central retinal artery occlusion, and this condition requires urgent medical evaluation. While interventions like ocular massage and intraocular pressure lowering medications have been used, their effectiveness again remains uncertain even in this condition also. Therefore, the primary goal is to identify and address the underlying cause such as carotid artery disease or cardiac emboli, mainly to reduce the risk of further vascular events. So that's the reason a detailed workup may include imaging studies of the head and neck, echocardiography and blood tests to evaluate for hypercoagulable states or vasculitis. Therefore, follow-up with ophthalmologist is often necessary to monitor for potential complications including retinal neovascularization. So therefore, by addressing the underlying etiology and providing appropriate care, the risk of further vision loss or systemic complications can be minimized. So this is what we need to know about all the important points regarding branched retinal artery occlusion.